My aha moment came as a kid. Like, I remember wanting to be a police officer and wanting to help people, but police officers don't get to sit and talk to people and dig into their lives and help them resolve, like traumatic issues. When I saw that there was this thing being a counselor and you actually get to talk to people for a living, that was what I wanted to do. I have an awareness and an interest in postpartum depression. Populations that I serve are adults through mature adults, so I have some octogenarians. I have a special heart for females and African American women and men to erase the stigma that comes with serving in mental health and making sure that everyone knows we all have a space to be able to let our emotions go and have someone safe to talk to. My first meeting with the patient is supposed to be about getting all the information, and while that is important, my most important thing to do in that meeting is to make sure that they're comfortable. I always tell people, welcome, you start where you want to start. We can start from today. If today was a hard day, let's talk about today. I'm very eclectic, so there will be some cognitive behavioral therapy, helping you think about your thoughts, how those thoughts turn into behaviors, and how, where those behaviors get us. The type of care that a patient can expect to receive from me is genuine, and fun. I do love to laugh. Even though a situation can be serious, there should always be room for humor and laughter. And so my goal is that you feel better than you did than when you walked in my office. When you think about therapy, it's one of the only people who really sit and talk with you, not share your information, not judge you. They're objective. And ideally, it should be a peaceful place. If I can impact somebody's life and help them to be better at what they are doing or what they want to do, that's a twofer for me, right? So I get to sit with people, I get to befriend them. There's always going to be a different phase of life that we need to manage. And so my job is to help people remember or find who they are at their core so that they can live the best version of themselves. At the end of the day, I love to help people. I want to see people grow, however long that takes. When I'm not with my patients, I love spending time with my family. As I do this work, there can be a lot of compassion fatigue. And so I also make sure that I have self-care. If I'm going to preach it, I need to live it.